Thank you, Emilia. Can everybody hear? Yeah? Okay. So just very brief, I'm going to be very brief actually on my remarks and my comments. Buenos Aires got the first case at the beginning of March, March 7, if I'm not mistaken, an international traveler from Italy. And the response was actually very quick in terms of advancing towards a total lockdown. That was, we had a kind of an advantage in this context, if you can call it so, which is we were 2 weeks ahead and seeing what was happening in Europe and Asia and other parts of the world. So we knew that social distancing and total lockdown was the way to go. That we needed to rush and try to implement that as soon as possible, and we did that in a very short period of time. And that was in coordination with the national government and the provincial government, which was also a very successful and interesting experience of coordination with the two branches of government, which are of a different party as we are. So that's one thing: social distancing and the contention of the spread. Right now we have about we are hitting 400 cases in the entire country. 70% are located in the metropolitan area of Buenos Aires, and we know that in the following weeks we are going to see what happened in many other cities already. So we are increasing the number of cases. That there is already the virus is already circulating with no connection with international visitors. So we do know that cases are going to increase, even with the very hard, very intense and early social distancing policies that have been implemented. So that's the second part of what we are doing. What are we doing in terms of people that are already sick and that we know that are going to become sick? Many of them are already in isolation. That's one thing that the government decided to do. So sick people in total isolation, and we are preparing the health system to receive those patients. As you might not know this, but the city manages all the hospitals, the public hospitals in the city, with the exception of 1 or 2. So we have total control on that. We are buying medical supplies, we are buying equipment, we are calling retired doctors, we are calling medicine students in the last years. In the last year, we are calling resident medical student, resident doctors to work with us. The thing that we need to solve, and I think this was mentioned before, is that there's no actual cooperation mechanism at the global level, and for cities that's also true, to buy this kind of equipment. We do have some local suppliers. They are working 24/7 to produce, especially ventilators and kits for detection kits. But that's not enough. We have to buy abroad, and that is creating a kind of a rat race among cities and countries, trying to find suppliers. Suppliers want to pay in advance and tripling the price. And that's something that for many cities, Buenos Aires and many cities of the global south, is very complicated to do. Basically, available stocks are going to the developed world. And we see that if we have if the pandemic hit us hard, that could be a problem. One thing that I also want to mention is some technological innovations that we found. We had our own bot, which usually answers things related to cultural activities, when you can where you can park in the city, etc., etc. We are now not only reorganizing the entire government the critical situation, crisis cabinet and another cabinet that works on a day-to-day basis of government. We also adapt all our technological tools to deal with the pandemic. So, for example, our bot is only devoted to answer questions about the coronavirus, and if you ask anything else, it will immediately give you information about the coronavirus. So that's something that we think is it was helpful for us. We had 7,000 consultations through that system, of which 1,000 were suspicious cases, and those were derived to the health system. Now, and this gives me the opportunity to talk about the third pillar, which is start thinking about the future. We are going to see a lot of telework or work from our own houses, and I think the medical system, the medical industry will change in this way, and we need to find ways to increase and to improve telemedicine, which might be a huge need in the following weeks even, but also in the following month and years ahead. Not only for coronavirus, but maybe for many other things. And this is part of something that we are starting to do, working with experts, universities, and key people from the private sector. Start thinking how the city will look like in the future when this pandemic is over. Not only immediate recovery, and for that we need the same funds we need for recovery as to buy medical supplies, and we don't have access to those, but that's another story. I mean, how the city will change in the day-to-day operations, the day-to-day basis. How are we going to interact with each other? How are we going to change the ways we buy our stuff, or we go to the doctor, or this kind of stuff? That's going to change a lot. The infrastructure, the landscape of the city will certainly change. We need to start thinking about that in order not to make mistakes in the future. Thank you.